So guys, today we will be talking about the flagellates, the intestinal and genital flagellates, and in that we will be talking about the Giardia Lamblia, right? So this is a parasite which causes a disease known as giardiasis. It is an intestinal disease, right? So first of all, we will be talking about the classification of it. So Giardia Lamblia, it can be differentiated into various species. It's based on the origin of the host, that is the Lamblia, this particular host which infects human, or Giardia mudis in the mice, or Agilis in the amphibians, Cetacea in the parrots, right? So they can be further classified according to their antigen, right? According to their genotype into 7 genotypes, right? So that is A to G, from which A and B is the most pathogenic. Now talking about the habitat. So in human, this particular bacteria is present in the duodenum, right? Duodenum, and in the upper jejunum. Now we'll be talking about the morphology of this parasite flagellate. So it has two state. One is trophozoid and another one is cyst. Now this mature cyst is infective, right? So it can when someone ingests something which contain this mature cyst, it can lead to the giardiasis, right? So first of all, talking about the trophozoid stage. Now how the trophozoid stage looks like, it is I'm showing you, right? So this is the axoneme. Now what is axoneme? Axoneme is the intercellular part of the flagella. This is the axoneme. Behind axoneme there is presence of two discs, right? Suckling discs, and here two nucleus. Within the nucleus, centrally placed karyosome. And these are the paravasal bodies, and the trophozoid stage has 4 pairs of flagella. One is ventrally, like this. I should make it here, or rather here. This is axoneme, the intercellular part of the flagella, and these are the suckling. So these are the suckling disc, right? And within there is two nucleus. The trophozoid stage has two nucleus and centrally placed karyosome. These are the paravasal bodies, and it has four pairs of flagella. One is two flagella are lateral, two pair of flagella are lateral, one is ventral and one is caudal, right? Like this. And so this is the trophozoid stage, right? Another stage is the cyst. Now this cyst looks like it is oval in shape, and it has, and maybe it's not good, it is like this, right? It has a thick wall and axoneme and 4 nucleus with paravasal bodies, right? So this is the cystic stage. like this. Now, according to morphology, it has two surfaces. One is ventral surface and dorsal surface. Now the ventral dorsal surface is convex, right, like this, and the ventral surface is concave, like this. So when you see from the lateral view, it is like sickle shaped, and in the ventral side there is adhesive pad or adhesive disc through which it can bind to the duodenal wall, right? So now we are going to talk about the life cycle of the source. Now I am showing you an image. This is the image. You can appreciate that this is the life cycle of Giardia Lamblia, right? So as you can appreciate, the cyst, this is the cyst, pass in the feces. I mean this parasite transmit through fecal-oral route. So cyst passed in the feces, and man acquired the infection by ingestion of the cyst. Then there is excistation of the in the duodenum. What does it mean by the word excistation? That means the cyst, the trophozoites are released from the cyst, right? So ultimately trophozoites are released, and then the trophozoite multiply by the longitudinal binary fissions. Ultimately, some trophozoites adhere to the duodenal mucosa, and some are passes through the intestine. And when passes through the intestine, some goes to the encystation process. So in case of diagnosis, we should find the cyst in the stool, right? So ultimately the development of in man, I mean how it develop within human. So there's I told you up in the life cycle, this how it acts through that. And there is I mean the parasite, when entered through the oral route, it adhere in the duodenum, and ultimately then it goes to the process excitation. Ultimately there is a release of the trophozoite. The trophozoite multiplies by longitudinal binary fissions, and some trophozoite adhere to the mucosal layer through the adhesive disc, adhesive pad, and ultimately they go on encystation. Now the process encystation, this process is promoting by some factors like alkaline pH in the intestine, right? Alkaline pH and conjugated bile salts, right, which mainly present after the duodenum. That is why encystation process is occurring after the duodenum, right? So encystation process occurs, and there is encystation specific vessels like this. If you think this is the trophozoite, right, this is the trophozoite, and when encystation begin to start, there's some vesicles are formed, that is known as encystation specific vesicles, right? Through these vesicles, the cyst wall proteins are transferred to the outer membrane, right? So that protein can help in formation of that particular cyst wall, that is a thick cyst wall, right? And then ultimately it passes through the feces and infect on the man. So now we are talking about, then we should be talking about the pathogenicity, and how it founds disease in human. So what are the risk factor? Now risk factor include it mainly affects the children, right? Mainly affects children or the elderly person whose immunity is not very good. And next we will talking about how it affects human, right? So when the trophozoite stage bind to the duodenal wall, right, then it destroys the epithelial cells and intestinal brush borders. So that causes the malabsorption, right? So malabsorption of what? Malabsorption of fat, right? Malabsorption of fat, that can cause I'm showing you here, it can cause malabsorption, right? So malabsorption of fat can lead to steatoria. It is also known as steatoria. Malabsorption of protein, right? malabsorption of vitamins and folic acid. Now this trophozoid, I mean, they has one protein that is known as CRP136, that is cysteine rich protein 136, which is a one virulence factor for the parasite, right? Now what is antigenic variation? Antigenic variation means these parasites, they I mean, what they do, they undergo frequent antigenic variation, right? So they could evade the immune system. So there are certain protein present in their outer membrane that is known as variant surface protein, right? VSP, variant surface protein. So they help in evasion of the immune system. Now the clinical features. What are the acute condition? What are the acute clinical features? I mean acute giardiasis. What are occurring here? Good giardiasis. So there is diarrhea, right? Diarrhea and I mean diarrhea along with fat, mucus, and there is abdominal pain, right? Bloating, belching, etc. Yeah, one thing I should uh, told you, that is the incubation period, right? The incubation period is 1 to 3 weeks. So boarding, belching, etc. Now it generally resolves within 1 week. Now in some cases this acute condition can lead to chronic giardiasis, right? In some condition, not in every condition. And when there is acute giardiasis, there is recurrent diarrhea along with mucus and blood, right? There is sulfurous belching, sulfurous belching with rotten egg test, right? I mean, the belching is like that. And sometimes presence of fever, etc, etc, right? And extra intestinal extra intestinal symptoms include urticaria, right? Urticaria, anterior uveitis, etc. Now what is the lab diagnosis? Now lab diagnosis, you have to go for the stool examination. One thing is stool examination, right? Now in the stool examination, where we can find the cystic stage or the trophozoid stage. For that, what we have to do, right? You have to do, what is that? That is a saline iodine or saline weight mount, right? Iodine or saline weight mount, you can do that. But here you can you can see the cystic stage of that parasite, but you cannot say that whether it is active state of the disease or not. But if you see the falling leaf-like motility of the trophozoite stage, then you can clearly appreciate that this is a active stage, right? Now here you have to know that when you doing the stool examination, sometimes the trophozoites are sickle shaped, and through their adhesive pairs they attach to the donor wall, so they cannot I mean they're not verily available in every stool, right? So should go for multiple sampling in the stool. I mean you should 3 consecutive samples you should take right? So sometimes in the stool we go through the concentration method. In the concentration method we can do formalin sedimentation or zinc sulfate flotation, right? Zinc sulfate flotation, these are the concentration techniques. Now when you are not finding anything in the stool, you go to the duodenal spirit, and this is known as, I mean, another thing that is known as entero test. And what is done here in the entero test? That's one entero, that means in the intestine. What is done here, one capsule is bind with thread, and other part is attached to the inner part of the gum, right? So it is then swallowed. After some time this capsule is dissolved, and 4 to 6 hours the thread is like थ्रेड वैसे ही वैसे रख दिया जाता है, ठीक है। सॉरी यार, थोड़ा सा इंग्लिश आ जाता है बीच बीच में, मतलब हिंदी आ जाता है बोलने में दिक्कत के लिए। सो दैट थ्रेड इज़ बेसिकली left for 4 to 6 hours, and after that it is taken and it is dissolved in the saline mount, and then microscopy is done to see the anesthetic autophagoid stage, uh, I mean trophozoite stage in the duodenum, right? So sometimes other parasites also we can find from this technique within the duodenum. Now the third one is antigen detection in the stool. For antigen detection we can go for ELISA, right? Or we can go for direct fluorescent antibody testing, etc. We can done, or also immunochromatographic test, right? Okay, I am showing you some images of the stool examination in wet mount and uh, iodine mounting. This is the image. It is basically saline mount, right? And these are the cystic stages of this. This is an iodine mount stain of the cyst. This is the trichome stain of the cyst, right? You can clearly appreciate this. This is the saline mount of the trophozoite stage, right? This is the saline mount, I mean sorry, this is not saline mount, this is a James stain of the trophozoite stage of this parasite. And this is the capsule, and there is a thread which is which is used in the entero test. So in the immunochromatographic test there is a specific test is known as tri-age parasite panel, right? Here in this test 3 types of parasite are diagnosed. That is, one is this Giardia Lamblia, another one is Entamoeba histolytica, and the other one is Cryptosporidium, right? Giardia Lamblia, Entamoeba histolytica, and Cryptosporidium. Other method in that is the antibody detection in the serum. For this we can do ELISA or indirect fluorescent antibody testing, but it is not very helpful because it is also positive in case of infection, that is past infection, right? So another one, that is molecular method. You can go for PCR technique and radiologic finding. You can go for X-ray in barium meal, right? Barium meal. So what is seen in X, but it is not specific, right? It is 20 in case of 20% it is positive. I mean it is specificity is only 20%, right? So what happens, what you can see in the X-ray in barium meal, only there is irregular thickening in the bowels, right? I mean in the folds of the intestine there is irregular thickening. So if you are going to barium meal X-ray, then you have to do the microscopy stool examination before the barium meal, right? Because there would be problem in case of that. And otherwise the treatment include metronidazole and tinidazole, right? Okay, metronidazole and tinidazole, right? So the doses I'm not going to talk about here. So thank you guys for watching this video. Goodbye.